So welcome to the another Feel Good Health informative wellness lecture here. The purpose of these lectures is really to inform you and for them to be practical, for you to learn about prevention and other things to take care of yourself. And so we have an amazing panel tonight. Dr. Vishnu Chandi and Dr. Shubha, and your last name again? Srinivasan, yes. Yes, and I'm flanked by two Indians here.
Indian areas.
Yeah. So Dr. Vishnu Chandi is going to talk first. He's the head of infectious disease at Metro Infectious Disease. He's my go-to guy for taking care of last patients for the last about 8 years or so. And everything from
more than that, he's getting forgetful.
Yeah, something like that. And so anything from a common pneumonia to, we diagnosed South African strongyloides case, and is all over at St. Mary's, 2 blocks away, and some other hospitals. So Dr. Chandi met the person who discovered Ebola, and I'll let you take it over, and he's going to get an Ebola update here.
Ooh. It's kind of an interesting little talk. It's an interest of mine. ASTMH is the American Society of Tropical Medicine and Hygiene. This ain't the tropics, and you don't get tropical diseases, but I was always interested in it. Peter Pyatt is a co-discoverer of Ebola. I met him at the UNAIDS when I'm an infectious disease doctor, and we do a lot of HIV work. So I was representing actually what was going on in India in the mid-90s, and so we were lobbying Congress at subcommittee meetings on this stuff. And that's when I met him, and I said, aren't you the guy who co-discovered Ebola? And he goes, yeah, but aren't you here for HIV? And I thought it was fabulous because from an infectious disease world, there are very few illnesses that kill 60 to 80% of the people that it affects. Ebola is one of them. And it's because you have no immunity to it. And it has a very interesting way of killing people. Of course, this is another guy we worked with actually in India again. Tom Friedman is a caricature. Tom Friedman is the guy who ran the CDC and sat there very nervously, giving very bad optics as he knows. But he's actually a very bright guy. He's a tuberculosis guy. He worked in Madras at what's called for the big TB clinic, and he was the head of the CDC to help eradicate tuberculosis. And of course, he gave a very bad statement about Ebola and kind of lost his face on TV. Anyone, you know what the Spanish flu was? None of you, right? Because you're all too young. In Chicago. You do know what the Spanish, not the Spanish fly, not the Spanish fly, we're talking about Spanish flu. Two different things. I know Spanish people. Okay, this is Spanish people.
I know what it was.
So this killed more people than World War I and World War II. It was basically the H1N1 influenza virus, which is circulating now. People have no immunity. And it killed young people this age here, 1 in every 3. In Chicago, you had so many bodies, you didn't have the ability to dispose of the bodies. And this was actually the way the hospitals were set up, because there was no hospitals that could accommodate this many people. And it started actually not in Spain, but in Kansas. But being good New York City, we mislabeled it Spanish, so the Spanish would get blamed for it. So this is Ebola. What is Ebola? Ebola's been around since, any guesses on when Ebola was discovered? 1976. 1976, there's been 25 epidemics of Ebola, and Ebola basically affects primates. It killed 5,000 gorillas in 2006, and right now we have over 25,000 cases of Ebola. And interestingly, nothing has changed from the prior epidemics. It's just, why does it happen? What's happening? What do you have in Africa other than Africans? They're poor, there's lots of war going on, there's lack of medical care, and there's traditional cultural practices. There, when people die, people tend to hug the bodies. Even in India, where I come from, you bring the body back home. You don't take it to a mortuary and kind of walk away and show up at the funeral and go, looks like grandma. You actually bring them home, and you take, at the end of the day, they take them to the area where they cremate the bodies. That's what we do. And in Africa, when you hug a dead person, like you do to touch them, Ebola gets spread. So where is this from? This used to be called Zaire, if you're into geography. There's nothing democratic or republic about the Republic of Congo, just so you know, okay? The Republic of Congo is one of the wealthiest places in the world. It has where all the diamonds, the oil, the rubber, all these things come from the Democratic Republic of Congo. Right now, where Ebola is occurring is in the Horn of Africa. Not the Horn of Africa, the west side of Africa. And interestingly, that's where all the slave trade originally started. Almost all of the Africans that are in this country come from that area. That was their exit point from Africa for the slave trade. Kikwit is where the original epidemic occurred. The big epidemic occurred there. The Ebola River was there. And what does it cause? It causes a disease that affects multiple systems. It originally starts out, if you think about it, what does the Ebola virus do? It gets into your body. How does it get into your body? It gets into your body with secretions. Sweat, tears, saliva. Not saliva, interesting, because your saliva inactivates the Ebola virus. Vomit, diarrhea. When people get Ebola, they get a gastroenteritis. What is a gastroenteritis? Vomiting, diarrhea. And they're throwing up all over the place. Their sweat is full of virus, trillions of particles, and a person this close, if you vomit on them, they can catch Ebola. All you have to do is to get it into your nose, into your eyes, and the virus gets in, and within 4 or 5 days you get symptoms, and you're only infected when you get symptoms. And you die usually within 5 to 7 days. What do they die of? Well, they're dehydrated, lack of electrolytes, which you need, and so their body shuts down from dehydration and kidney failure. Only later on do you start getting the bleeding that everyone's famous for. And that's because your liver fails. And the liver is where all the materials are made to prevent you from bleeding. And so, overall, what does it do? It causes all the blood vessels to get leaky, and you become like a big bag of water. All the blood that's supposed to be inside your blood vessels goes outside your blood vessels, and bad things happen to you. So what should we really be afraid of? Okay? There's 300,000 obesity deaths in America. There's 450,000 deaths from cigarette smoking. There's 88,000 deaths from alcohol. And we've had 2 deaths from people who've come in from the outside from Ebola. So that's a great cartoon. This was in the Sacramento Bee. This is what the virus looks like. There's 5 types of Ebola. The main one that we always deal with is Zaire. And if you look at the relative infectivity of Ebola, so what killed off all the American Indians in this world?
Smallpox.
Well, not really. It's measles. Close. Smallpox. So what happened was, before the first white man stepped on this continent, there were traders. And the traders were trading fur, and they had measles. Measles is the most infected virus out there. If all of you were non-immune to measles in this room, and I had measles and I left this room an hour earlier, 80% of you would catch measles. Of which, if you were immune, non-immune, more than 60% would die. Okay? And the American Indians were non-immune to measles. So before actual Christopher Columbus stepped foot here, the people from Norway and the Vikings wiped out most of the American Indians by just stepping foot on the continent. So hepatitis C, this is called the R naught, or the reproductive number. So for every case of 1 infection, hepatitis C causes at the most 2 infections like Ebola. It's way down on this scale. The most contagious is measles, then mumps. Mumps is a big epidemic right now. How many of your Chicago Blackhawk fans? There's a huge epidemic of mumps going along in the hockey world. Okay, and this has to do with people not getting their kids vaccinated. I live in Oak Park, the People's Republic of Oak Park, where all my wife's friends don't want to get their kids vaccinated because they're all big Jenny McCarthy fans. I was only interested in Jenny McCarthy when I was much younger for various other reasons, but not anymore. Okay, because that was the dumbest woman alive. Vaccinations are why you're all here. Vaccinations are the most important things you do, not doctors. Vaccinations and the toilet, the 2 things that keep civilization going. So how does Ebola spread? We never knew, but it's really these fruit bats. The fruit bats eat fruit. They're big bats, but yay big. And anyone who lives in the tropical world sees these fruit bats. And they drop the fruits on the ground. The wild animals, the gorillas, the chimpanzees, the dual carriers, eat these bats. How do humans come in contact? In Africa, they eat bushmeat, which are these animals. They eat gorillas, they eat monkeys, they eat these other animals. And when they slaughter them, it gets up into their skin and they catch Ebola. They come back home, they give it to their family members, and then the people that really get ill, Dr. Gaziano, myself, the people who take care of them, we die because of the secretions. Because Dominic would call me and be like, you take care of it. Smarter! So this is my Nectaris torquata, which is the red ring, which is the little collar fruit bat, which is the transmitting agent. And why else is this happening? Look at the number of flights every week that come to the United States. We have a lot of, the world is very small. It took, in 1850, more than a year to go around the world. It takes less than a day. So people from all over the world come all over. It's amazing how many flights come in. And this is basically this is what tells you how quick it is to get around the world. The other thing is deforestation. Well, why do we care? Well, as the forests have shrunk, the animals have had to live in a closer and closer area. And these animals then transmit more infections amongst each other. And so we're getting into contact with animals we shouldn't be. And then what is this area? If you look at those little H marks, those are all the hospitals. If you get up on top of St. Mary's, there is more hospitals that you can see around this area than all of Sierra Leone, Guinea, and Liberia put together. There are no hospitals there. This is an unbelievably poor area. So what happens? You get infected. You're only infected at the time of symptoms. Spread is not airborne. It's really by touching people. And what do you get? You get headaches, myalgias, abdominal pain, vomiting. It's like a bad Saturday night. Right? So you only hemorrhage a third of the time there. And the incubation period is 8 to 10 days. So I think we'll stop there. I don't always treat Ebola, but I do look it up on Google.
There's a lot of information on Google.
All right, so what do? You give them fluids, okay? And none of the therapies have been proven to work, but we'll stop there.
Let's open up for questions.
Yeah, I think it's much more fun to ask the
Two
questions.
questions here. We're going to move right along to genetics. Any questions?
I have one quick question. So does the virus have to mutate to transmit from animals to humans?
No. Interestingly, Ebola is a filovirus. It's like yellow fever, Lassa fever. This Yassa fever is the other filovirus. It lives in bats. And do you guys remember SARS?
Yeah.
Anybody remember SARS?
Yeah.
So SARS also occurs in the same exact bats. And unfortunately, the Chinese thought it occurs in things called the civet cats, which are like these raccoons. And the Chinese eat everything. I mean, if you go to what Chinese eat, they eat everything. And they were eating the civet cats, which are raccoons fundamentally. And when they were slaughtering these raccoons, they got infected. And then there's a wedding party where this one person came to this market in Guangdong. This is how it tells you how small the world is. So he goes to Guangdong, which is a major industrial area, and then he goes to a wedding in Singapore. The incubation period is like 5 days, 3 to 5 days. It's a common cold, coronavirus. He goes to the wedding party, hangs around, hugs everybody, infects about 15 people. They fly all over the world. In the airplane, people started dying. People dying in Toronto, Switzerland, London, all over the world. 850 deaths from one wedding party coming from one bat. That's how viruses happen when you interact. So to make a long answer to a short question, it doesn't mutate. These are normally occurring viruses in these species. And we're getting more and more contact as we're deforesting things. So you'll see more and more. There's a lot more humans to kill. We didn't have 7.5 billion people.